A raging debate at the top of our hot sauce today. We are talking about health care. And the Supreme Court, this is why it's in the forefront, especially this week. The Supreme Court's historic decision of the Affordable Health Care Act is expected to come down sometime this week, possibly tomorrow, Friday. But what does it actually mean for your family? I mean, breaking it down, you would have to be a law expert, a legal expert, a medical expert. We have Julie Snyder, Director of Corporate Relations at Blue Cross Blue Shield, and she is here to try and simplify it for all of us folks at home who really are thinking, how is that really going to affect us? Now, you call it, the company calls it Blue Cross Blue Shield, the 40,000-foot view, because of the complexity of it all. So many aspects.
That's true.
You have broken it down for us for 4 different scenarios.
Right.
Let's start with the first one.
The first scenario is that the law that Congress passed, remember a mandate at the time of the last president's election, that Americans wanted more affordable care and that Americans wanted everyone to have access to health care. So the law was proposed, it was written and passed by Congress, and the first scenario is that the Supreme Court will uphold the law that Congress passed, and the law stands.
And the law is that it requires basically every American to have health insurance.
Correct, because every American at some point in their life will access the health care system. So what this law does in terms of improving access to care really creates a very large insurance pool. So if you're not already getting insurance through your employer, if you're not Medicaid eligible, you will then go into the exchange and have the ability to go and select insurance at a cost that you can afford.
All right, let's go to the second scenario.
Well, the second scenario, I'm going to actually take you all the way to the other extreme.
Okay, great.
The other extreme is that the entire law is ruled unconstitutional by the Supreme Court, and they basically null and void the law.
So we're back to square one.
So we could be back to square one, but the good news for people in New York, and especially in Western New York, is that we already have many provisions that the federal law has here in New York State. We already have insurance available to individuals. It is expensive because usually people that seek it are already quite ill. But we also have Family Health Plus and Child Health Plus, so we have gap insurance in New York State, and I think that our current governor is working to continue toward that. The other good news in Western New York is that we have a great healthcare system here. We have 2 major hospitals and health systems. We have a great medical school. You know about the Buffalo-Niagara Medical Corridor. I mean, health as an industry probably employs and creates more than 20% of our regional GDP. So in Western New York, we're doing better than the rest of the nation. So as we think about this law and we all wait for the decision, I think that the most important thing, especially for a company like Blue Cross Blue Shield, we're really here for our members. We want everyone to be a little calm because until we see what the decision is,
you can't really tell.
We really can't tell.
Can you explain this? We're going to break into the scenarios, but if,
Sure.
let's say it is passed,
Sure.
how will that affect insurance companies, and how in turn will that affect me who is paying for insurance from Blue Cross Blue Shield? Will that make my rates go up?
Well, if the law passes as it's written, we really cannot tell for sure what will happen with rates. Most individuals, such as yourself, that have insurance normally get it through your employer. And we know that the cost of health insurance really reflects the cost of care. Right now, even if people are uninsured, you probably are still helping to subsidize their care through your employer's health insurance premiums. If the law passes, we would imagine that that rate of increase will not be so rapid.
So much to discuss. Unfortunately, we are out of time, but
Sure.
if you're interested, and everybody should be, you are holding a symposium where our own Don Postles from News 4, he's going to be part of this Supreme Court symposium sponsored by Blue Cross Blue Shield. It's Friday at 10 a.m., and it will be streamed live on WIVB.com.
Right, and we really want everyone to sit and listen to some great experts, Western New York and nationally, and we're going to be there. We've been here 75 years. We're going to be here for many more years to take care of the community.
Excellent. You are my insurer. All right,
Great.
Julie Snyder, thank you
Great.
so much for joining us today, and we'll be paying attention to the Supreme Court ruling.
Super, Victoria. Thank you.
Thank you. All right, with that, we're going to head back to our newsroom and our web producer, Emily Lenahan. Hey, Em.